Hello and welcome to my dermatoscope reviews. This is the Heine Delta 30 Pro dermatoscope. And for today, as usual, I'm just showing you the equipment. To learn how to use it in more detail and how to interpret what you see, please come along to one of our Dermoscopy for Absolute Beginners events, which you can access through the PCDS website, pcds.org.uk. So this is the Heine Delta 30 Pro dermatoscope, and when you get it, it comes in this case, hard case, which will hold it securely like this. So I'm going to put the case to one side and show you the scope. So here's the scope itself. The switches, we have in the middle here a clearly labelled on-off switch, which turns it on and off, strangely enough. And having turned it on, we've then got some more switches. On this side, we've got one that says P, and P stands for polarized. And if you look at the lights on this side, can you see there is a little one there that says P, and this is above one that says C. Now, at the moment, the C one is a blue light and the P is a white light, but it's lit up. If I press the polarized button, you can see that that P light, this top one, is coming on and off. It's easier to see if I cover up the one underneath it. When the light is on, it is polarized. When the light is off, it's non-polarized. And you can see the light changing as I press that button. The other indicator here, C, stands for color. And this is the C button here, the color button here. And what this does is it changes the color of the light. And you've got 4 different shades. So you can go from a quite yellow light, which will have a yellow color here, through different shades of blue until you get a fairly blue light on the 4th one. And you can see the color light here. I don't know how easy it is to see, but it has gone blue. So that's the polarized and color modes. The other button on this side, you have a brightness button. And if you press that one, you will find that you have got 3 different levels of light intensity as well. On this side, these 3 buttons here, these 3 lights here, I'm just going to cover that up so you can see them more easily. I've got 2 greens and a red here. This is telling me how well charged it is and how much charge we have left. Now, to focus this one, we are going to twist the eyepiece, and rather than extending the end plate, it moves the eyepiece closer towards us and further away from us. That's absolutely fine. This one does have a marker so that you can see how far to extend it to focus it. I don't know if you can see that terribly easily there. Try and get it to show up. But it has a marker, and in the middle position there, that is now focused for taking photos of a flat lesion. If you want to take photos, you're going to be using your phone as a camera for most people. And the real game changer with the new Heine dermatoscopes is the adapter. Now, the adapter comes in 2 parts. There is this part here, and there is this part here, which I have already attached to my phone. This little button is self-adhesive. You can buy them separately, and you can buy multiple buttons, and this sticks to your phone and stays on it permanently. It doesn't stick out any further than the ordinary button on the back of my phone, but what it does, it has this little bit at the side, and you'll notice on this one there's a little bit there, and that just lets you attach this magnetically onto it, and now you can attach the scope to the phone, and that is firmly attached. That's not going to move. If you move the phone relative to the scope, you will find it does change the focus of it. You can see it's moving this bit here as well. And so when it comes to attaching the phone camera to the scope, it's very important that you've already got it, the scope lined up with the skin, and you've got the camera lined up how you want it to go so that you don't have to adjust it once it's on there. So that is the adapter. Now, this adapter is absolutely brilliant. I completely love it because it doesn't have the issues that you have with some of the other adapters. and I can show you some of the other adapters. So this one is a Heine adapter, and this is a stick-on adapter. So you peel this bit back and then you can stick it on for your camera. But then you've got this large piece of plastic attached to the back of your phone all the time, whereas the little button is much more convenient. You can use this scope with the Dermlight adapters. The Dermlight adapters will work with it. You can see they don't line up brilliantly, but it will work. There is enough magnetism there for that to work. And there's this one, and this is the other type here. But these two adapters have their own issues. So with this one, when you put it on your phone, sometimes you can accidentally turn your phone off because you're pressing on the buttons at the sides. And this one clips over the top of the phone, but you have this part touching the phone screen, and it may just obstruct the bit of the screen that you need to get to. And some of them don't like working with at all. So this adapter is the absolute game changer, and in my opinion is a reason to buy one of these new Heine scopes, because the adapter is just so easy to use. You can use it for multiple different people. So if you've got it on your phone like this, and I've set this up for my phone here, and someone else wants to share the adapter and the scope, all you have to do is get another one of these buttons, attach the button to this bit, and then peel off the backing. And then when you go to the new phone to attach it to, you work out which camera it's going to be, you put it on and you press it on, and then it will be in the right place. And the reason I suggest doing it that way is because you can adjust it. So you can put it on. If you just pull this up and twist it, you can now move this to line it up with different cameras or to line it up differently, and then you can attach it back down again. That's absolutely fine. It's much easier if you don't have to do that. And the other thing to say is that if you've got people doing that, lots of different people doing that, and they unscrew it too far, it will come apart into the three pieces, and that can be very irritating, particularly if this screw gets lost. All parts are replaceable, but it's nicer not to have to do that. So I'm just going to attach it back on, otherwise I will never be able to get it back again, get it back off again. Here we go. And now I can take the adapter off and put it away. So here's the scope. Now, this nice big end plate will come off if you want to take it off. And the main reason for taking it off is if you want to do polarized non-contact dermoscopy. And the other amazing thing with this one is this little bit of kit. So this goes on instead of the end plate. Just goes on like that. And now we can use it. We can go over the skin and we can have a look at lesions like this. The brilliant things about this are it holds it exactly the right distance you need it to from the skin in order to do that polarized non-contact dermoscopy. But it also has these gaps at the side, so that if you want to, for example, use your dermatoscope and get a splinter out or something like that, if you want to put some tweezers or some instruments in through those holes, you can. So you can use it whilst you're actually doing something. And the other thing is that this lets you move it across the skin, and it lets you scan multiple moles. And that's also very, very helpful if you've got a patient with lots and lots of moles. So this is a very good scope for use, for example, in a secondary care clinic. And then to take the end off, you just literally clip it off. And then we can clip this one back on again, making sure that we push it on very firmly, because this is glass, and if it's not pushed on firmly enough and it falls off, then this will crack and break. The charging port here is on the bottom end. I don't know if you can quite see it there. There is a charging port there on the bottom end, and that is a USB-C charger. So that's a standard charger, just as you might use for your mobile phone. When it comes to cleaning the end plate, because it is completely enclosed, you normally just have to clean the outside of it with an alcohol wipe. But if you are taking it on and off to add this piece, then you may find that you get dust on the inside of the glass plate, in which case you'll need to take that off and give that a wipe with a lint-free cloth from time to time. There are no disposable hygiene caps for this one, but you can use cling film over it if you are using it on bleeding lesions or on mucosal surfaces. So this is the Heine Delta 30 Pro. Now, the one big thing that is different between the Delta 30 Pro and the Delta 30, apart from being able to change the colour intensity, also the colour of the light, the main thing is that the Delta 30 Pro does show the polarisation specific white lines very clearly. The Delta 30 did not, the Delta 30 Pro does. And so it is a very good scope. It's got good optics. It shows the shiny white lines well. It is easy to use. Although there are plenty of buttons, actually it's relatively simple to use. And the colour light thing, in theory, the yellow light should be better for looking at pigmented lesions, and the bluer lights should be better for looking at shiny white structures. I think that probably is the case. It's a nice thing to have. It's not a must-have, but it's certainly a nice extra. But the real game changer for these ones is the new adapter, which won't accidentally turn your phone off, or won't obstruct your screen, and won't leave a large thing on the back of your phone so that you can use it again and again. The scope fits into its case like this, and into the case you can also fit that bit and the adapter. There is just about space for all of them, and you can zip it up securely afterwards. So that was the Heine Delta 30 Pro dermatoscope. And as always, today I'm just showing you the equipment. To learn how to use it in more detail and how to interpret what you see, please come along to one of our Dermoscopy for Absolute Beginners events, which you can access through the PCDS website, pcds.org.uk.